For our next speaker, I'd like to call on Dr. Gideon Lasco. He is a physician and a medical anthropologist. I was looking at the chat, and it seems like there is a reunion going on about among the classmates who took medical anthropology together in the room. He is also a writer. He is a health reform advocate and was elected as an Atlantic Fellow for Health Equity in Southeast Asia in 2019. During the same year, he co-authored a civil society report on the state of drug policy in Asia and wrote the Asia chapter for the Global State of Harm Reduction report. And he's here with us today to also share his experience in working with young people who are engaged in methamphetamine in the Philippines. Dr. Gideon?
Good morning to all of you. I'm Gideon Lasco, and I've been doing research on drug issues for almost 10 years now. And what I want to do with you today is for me to just to share some of my personal insights and my personal journey in conducting research around drug issues. So it all started in grad school. I was classmates with Ines, who's one of the organizers of this conference. We were doing medical anthropology back then, and Michael Tan, who you heard from as a keynote speaker in this conference, was one of our professors. So I was tasked to do research on young people's chemical lives. But when we say chemical lives, I was referring to, we were very curious. Michael Tan and Professor Anita Hardon from the University of Amsterdam, they were forming a research team to explore young people's chemical lives, meaning to say, what are the different cosmetics, different drugs, different chemicals that they apply on their bodies or take with them, inhale, drink. So it includes alcohol, tobacco, etc. So I signed up. I was very curious. I was starting in medical anthropology. I used to be a medical doctor. Well, I still am a medical doctor, but I used to think that I would follow a clinical trajectory until I rediscovered the social sciences, which I was already interested to begin with. And I was very eager to get some field experiences. So I ended up joining them. And when I interviewed these urban poor young men about what chemicals they use, they ended up confiding in me, volunteering that they use methamphetamine. So at first, I didn't want to tackle that because I knew it was a sensitive topic even then. But because the young people kept talking about it, I realized that it's what's important to them. And with the support of my advisors, we agreed that I would explore it more. So as I hang out with these young people, 2012, 2013, I learned why drugs fit in their lives. I learned the usefulness of drugs in their lives. They call shabu pampagilas. And by pampagilas, they mean it's like an energy booster, a performance enhancer that allows them to perform in their tasks. They worked as vendors in the port. They worked as porters in the port. They took all kinds of income generating opportunities, what they call mga pagkwartahan. And they also use shabu as the way young people use alcohol, which is also a drug, by the way. And they use it in their inuman or drinking sessions. It's like a social drug in the same way that alcohol is what some scholars call a social lubricant. So all of these experiences, and of course, I do not want to romanticize methamphetamine as a drug that's helpful because I also saw the harms in shabu use. It cost a lot for them. It cost a big proportion of the little income they get, and they also admit that it can enable them to do violent behavior or to exhibit violent behavior. But what I saw in the field was much different from what I thought shabu is without this ethnographic work as a dangerous drug, as a drug that will destroy people. But what I saw is much more complex and nuanced than that. It can be something that young people use towards a certain goal that they have. And contrary to portrayals of these young people as addicts, they are in fact just like the other ordinary young people that I meet in my everyday life, or it's just like the young person that I was. I once was someone who sought the company of friends, someone who needed a lot of energy to survive. So in the same way that as a medical student, we drank a lot of coffee, these young boys, these young men look to Shabu to give them the performance enhancer that they were looking for. And this research eventually got published in 2014. And then I moved on to other research topics. But then 2016 came, and the drug war, the thirdest drug war happened. And suddenly I was reminded of my interlocutors, the people I hang out with, these young men who shared their lives to me. And I was suddenly caught with the fear and the thought that they might be victims already of tokhang. They're very vulnerable. They don't have any connections. They are very marginalized from a socioeconomic perspective. And I realized that I have the commitment to revisit the data, to publish data that will contextualize, because the politicians, Duterte, were all portraying drugs as destroying the country, and these people who use drugs as zombies, as the living dead, people who deserve to be killed and have no chance of rehabilitation. So all of these portrayals essentially enabled the people who I have come to know to be killed, to be delegitimized as human beings. So I revisited the data, I published more papers, and I became involved in policy analysis. I became involved in public forums, writing about the drug war, and eventually doing more research to prove that instead of vilifying people who use drugs, we need to look at the social economic context of why they use drugs in the first place. So for the young people that I met, that for the young people that share their lives to me, there's meaningfulness in the use even of highly stigmatized drugs like shabu. And through this work, I began to be exposed to other literature in the region, finding the same things, resonating with the same ideas. And of course, harm reduction, which is a principle that focuses on the harms that are associated with drug use, was a perspective that I have come to embrace given the ethnographic reality that I saw. Because for the young people that I've met in 2011, 2012, and at the same time in 2017, the real harms that come to them doesn't come from the drug itself. Although, of course, like I said, these substances are powerful substances and can also lead to addiction. But the majority of the harms that they are exposed to actually come from the persecution the exclusion, the marginalization that they get because they are identified as people who use drugs, as addicts, as people who are subject to not just killings, but jail detention that's indefinite and very, in terms of humanitarian conditions, very inhumane. So through the work that I've done, I saw the importance of doing research to challenge the narratives that are being foisted upon the public by politicians who use drugs as a populist trope. Because these politicians build on decades of stigmatization towards drugs, decades of moral panic around drugs, and they capitalize on this and convince people that they're somehow the saviors of society because they're going after these people. But that's a very misguided and warped view of reality, of ethnographic reality, in which people are caught in socioeconomic environments that in fact, favor drug use. And that's just one of the drug worlds in the Philippines. There are many more, and there are many more drugs beyond Shabu. So we need more research. We need more people to work with communities and dignify them through scholarship, to bring out their voices, to empower them, to work with them, and to make sure that in the end, the goal of policy is to reduce harms to individuals and societies alike. And I think that there is hope because now more than ever, there's a recognition that we can do something about this and that the drug scholarship is important. So I really want to encourage everyone to support research on drug issues. We need more ethnography. We need historicization. So where did these ideas come from? Where do these misconceptions about drugs come from? How do the drug use patterns change over time? What are the impacts for people, individuals, women and men, children and adults? We need more research. And I hope that our discussion will be constructive towards what else we can do to support the goal of not a drug-free world, but a world in which people use drugs for different ends. So that's it. Thank you.
Thank you, Dr. Gideon. That was quite interesting. The experience on how you came across this community, even though you were not actually pursuing them, and it shows actually how I think it shows how people from the margins are just looking for an opportunity, an avenue, a platform where they can share their experiences. And though we focused on Dr. Dan's presentation earlier about how research can help us develop better programs, I like what you said about the function of research also to challenge existing beliefs and norms that probably are not based on research, but just based primarily on people's perceptions and biases. And so the importance of also doing research to make sure to inform people that there might be existing interventions that are not working. And so we turn to research and listen to communities to find out what we can do better.